Hello, and welcome to completing an intake note in Therapynotes. I will be walking step by step through an intake note in Therapynotes so that you are clear on exactly what the expectations are. Once you get logged into Therapynotes, you're going to click on the three bars in the upper left corner and go to Patients. You can either click on the patient's name from the list of clients that have been assigned to you, or you can do a search if you need to find a client. Once you have clicked on the client's name, you're going to click on Documents, Create Note, and then Intake Note. It's going to ask you if you want to create a note for an unscheduled appointment if you have not already scheduled the appointment into Therapynotes. Once you click on that, it's going to open up a new appointment screen. The appointment type in the first box is going to be therapy intake. Then you should see your client's name. Then you should see your name under clinician. Next is location. Your location should be wherever you saw the client. So if that was in their residence, their home, if it was at your office, or if it was the school or somewhere else that wasn't your home or the office, then you'd want to click on community. The service code for this is going to be 90791, which is psychiatric diagnostic evaluation. You want to make sure that your date is correct. Ideally, you would be putting this in at the time of the intake, but if not, make sure your date is correct because you cannot change it later. Then you're going to put your start time and then how long it took you to do the appointment. If you have not filled in all of these boxes, it will not let you save. Once you have, you're going to click save, and then it's going to open up your document. You'll be able to see all of that information you just put in at the top in your heading, and then you're going to go into your presenting problem. The presenting problems section explains why the client is appropriate for services. It should give an overview of the client's history, including their placements, their previous treatment, their trauma and or hospitalizations. It should list what their current and past symptoms are, including the intensity of the symptoms, the frequency of the symptoms, and the duration of the symptoms. For example, being able to say that the client has been experiencing anger outbursts on a daily basis, lasting approximately 3 to 4 hours each time and happening, like I said, on a daily basis. The intensity would be described as what goes on during these anger outbursts. Are they kicking and screaming? Are they throwing themselves against the wall? Are they destroying property? Are they withdrawing? Are they cursing? Are they verbally abusive? You want to give very specific examples of what the symptoms look like in this particular child, because a symptom for one child could be radically different in the next. You also want to include the behaviors that require intervention. So we want very clear and accurate descriptions of what is going on, who is it impacting, is this only with siblings, only with peers, only with authority figures, when did this start? The onset is very important. If this has been going on for 2 months as opposed to 2 years, we want to have all that information here. Next, we're going to do our current mental status. This is going to reflect how they were at the time of session. If you click all normal, then make sure that you are checking that the insight and judgment are accurately reflected. If there's no notable behaviors or issues with the client during the session, then all normal would be appropriate, but very seldom is it that their judgment and insight are also going to be normal or good, as it will default to. The risk assessment is for if your client gives you any indicators during the session that they may be harmful to themselves or others, if they're making threats, if it's about something in particular, if they are threatening suicide, then that's a whole separate protocol that will be dealt with in a separate video. But you want to make sure that whatever risks are presented, that you are noting it here. If they are saying that they're going to continue to harm their siblings, or they've had suicidal thoughts in the past and they still have them regularly, you're going to want to make sure to fill out the risk assessment section. Don't So if they do not present with any risk, then you're going to click the patient denies all areas of risk box. If you don't click it, then it will not then it will require that you fill it out. If the client mentions anything that needs to be reported to house staff after this session, then you're going to make sure to put it here. So if they're going to harm themselves, they're going to run away, they're going to harm someone else, those are all things that need to be put here. Next, we have our objective content section. We're going to make sure that HIPAA and confidentiality have both been discussed, explaining to the client that what sorts of things will have to be reported. So if they say they're going to harm themselves or someone else, that has to be reported, including running away, cutting themselves, anything toward, like not eating, anything that's going towards harm. You want to review cancellation practices, what you expect and how they can reschedule a session, give them good reasons for why they wouldn't complete a session, such as being extremely tired, being sick, or having other commitments. If there are any fees that need to be discussed, if there's any billing practices that they need to be aware of, you want to make sure that you document that those things were discussed here in the objective content section. You also want to note the scheduled days for services and how long the client should expect to spend in sessions here if possible. Now we're going into the biopsychosocial assessment portion of the document. For identification, you'll see that it will tell you the age that the client is at intake. All of these next boxes in gray will give you a reminder of what is expected in these boxes. One of the most important things is for you to hit on everything that is in gray. If it does not apply or is not relevant for this client, then say that. Not saying anything does not equate to there is nothing that would go under this section. The identification box requires the client's current age, their gender identification, the referral source, which if they're in foster care or a group home, generally that's where it would be. If they referred themselves by looking on the internet and finding the service, or if their insurance company gave them the information. But we definitely want to know how they came to be a part of services. We want to know their ethnicity, how they identify, whether that's Black, Caucasian, Hispanic, if they have a particular country of origin, as specific as we can be there. We want to know their religion. Denomination is helpful. And we also want to know their marital status. The next section is the history of the presenting problem. This requires listing out the symptoms along with the specific behaviors of the diagnosis that they have, when they started, how long they last during an episode, and then how frequently the episodes are occurring. So that if the behavior is that they're having anger outbursts, then we're going to talk about what those particular behaviors are. That they're screaming, destroying property, and being verbally abusive. This is happening on a daily basis. It lasts for 2 to 3 hours at a time. And then maybe be more specific in the intensity. So to be able to say that they've been arrested for destroying property, or they've disrupted previous placements due to their anger outburst, and things of that nature. The next box is psychiatric history. This is going to require the client's current diagnosis, previous diagnosis, current symptoms, previous symptoms, hospitalizations, and any previous courses of treatment. So if they've done targeted skills, if they've done individual therapy, if they've gone to support groups, or if they've never done anything, we want to include the history, whether it is present or absent. Next, we have our trauma history. This requires the type of trauma, and at the bare minimum, if they're in foster care, we want to know what brought them into care. We want to know when it occurred and who it involved. So, just to say that they came into care for neglect is not the same as being able to say that at the age of 4, their mother was not taking them to the doctor, had not um, had not, or I'm sorry, not maybe the age of 4, it'd be easier at 10, that they hadn't been going to school, they hadn't been going to their doctor's appointments, they weren't being fed regularly, mom was not diligent in their hygiene. We want to know specifically what the neglect was. It could have been from a previous foster home, it could have been sexual abuse. As best we can, we want to be able to say who the abuser was, how long, and how often was the abuse. There's a difference in an uncle exposing himself once versus a father who raped a child for 3 years. We want to make sure that we have that information up front so that we don't have to gather it again. If your client is unable to give it to you directly, then you would want to consult either collateral contacts, which would be their parents, foster parent, caseworker, or their case record. So their common application, a psychological, or something else that would give you this background information. We don't want to rely solely on our clients, especially when they're children. Even if they're teenagers, teenagers can be dishonest, they can be misleading, and we don't want that in this document. Family psychiatric history requires a mental health diagnosis of any family member. Also, if they suspect that their family member may have had some sort of a diagnosis, if they can detail symptoms of mental illness. Having a mother who exhibited bipolar symptoms is important to note, even if mom was not diagnosed. So you may, if they're not diagnosed, you may just list the symptoms. They may be able to tell you she had mood swings, she had periods of time where she was very depressed and couldn't get out of bed, and then she also had periods where she had a whole lot of energy and wouldn't sleep and was over the top about everything. Next section is medical conditions and history. We want to include all medical, both past and present conditions, the treatments, if they have any allergies, anything else that they've got going on. So high blood pressure, eczema, diabetes, those sorts of things would go here. The current medication section should include the name, the dosage, the purpose of the medication, and the prescribing physician from either their pill bottles or from a log provided by the house. But simply saying that they're on medication for ADHD is not what we're looking for here. We want the particulars. In the event that your client has a medical event in your presence, God forbid, and you needed to call 911, this is where we're going to get the information. If there's a change or a disruption in their medication, this is our way of knowing what they were doing at the time of intake. The substance use section requires a history of substance use by name and duration. This also includes alcohol, tobacco, and marijuana. Vape pens are very big these days. We want to take note if they are using any of these substances. Bonus points for the source. Where are they getting it from? Is this something that they are actively seeking out, or is it just if it happens to be in front of them? Those are different things. Next is family history. We want to talk about their family of origin. Even if they're not speaking to their family of origin, this is where we would note that. If they're doing weekly phone visits, if they have a reunification plan in place, if parental rights have been terminated, whatever their relationship is with their parents, their siblings, their cousins, or anyone significant in their life. It could have been a previous foster parent. It could have been a teacher that they lived with for a few years. We want to know all of these different dynamics so that later on when we're doing treatment planning and they bring up their aunt, we can go back and see, well, what do we know about this aunt? Has this aunt ever been mentioned? Is this something new, or is this someone that they've been visiting with for the last 5 years? It will also speak to different issues that they may have that arise out of abandonment or some sort of trauma related to their family, not having access to them. If they've never had access to them, that's what we want to include here. Social history requires listing the nature and quality of significant relationships and social supports. For this question, you might ask, if you're going through something, who would you talk to about it? It may be their caseworker, it may be a best friend, it may be a teacher, it may be the house mom, whoever it is. We want to know who they would go to. Who do you turn to if something is going on with you? Who would you want to celebrate with? If something happy happens in your life, who's the first person that you want to tell? Who's the second person? Next question is spiritual and cultural practices. This section requires listing how they practice their spirituality. If they pray or go to church, if they celebrate religious holidays, and if they do, how so? They like to decorate, they like to eat particular foods, they like to buy gifts, they like to receive gifts. Also, for culture matters. Everyone has culture, whether it's because they're black or Hispanic, or if they're white. If they identify heavily with being a Texan or being from another state. If it's as a Southerner, if it's just as an American, if it's whatever it is, your culture is going to be influenced by the food, by holidays that they celebrate, by music, by going to public schools, by enjoying sports. Soccer isn't as big here as it is in some other countries. That is a way that they are exercising their culture. If they are listening to music in a particular language, if it's country music or pop music or rap music or whatever it is, whatever they're doing for their food, for their language, for their slang, whatever community they want to closely identify with, we want to note that here. You can't ask, so what are your cultural factors? You have to ask those sorts of questions. So, what kind of music are you listening to? What kind of food do you enjoy? What do if you're going to list who you are, what would you include on that list? Same thing with religion and spirituality. You want to make sure that you're asking in a way that you're going to get an answer, as opposed to how do you practice your spirituality, especially with a child. You want to ask them, do you celebrate any religious holidays? Do you have any favorite traditions that you grew up with or that you're looking forward to having when you grow up? Now we have our developmental history. We want to speak on if there are any developmental milestones that have not been met on time, or if they were, and we want to detail any delays. So if they were ever in speech, occupational, or physical therapy, if they took longer to start walking, if they hit puberty early or late. For an adult, you might talk about if they, at what age did they reach independence? Were they late to start in life? Do they feel like they are behind? Did they go to pick up a trade or go to college when they were a young adult, or versus being older? Um, they might be later in life where they've had to retire early, or they weren't able to work as long as they wanted to. They may feel some angst around their children. Maybe there was a troubled pregnancy, or their adult children who've not moved out of the home and they want them to. They feel like they should be an empty nester and they're not. These are things that we would list here in developmental history. Next, educational and vocational history includes their current grade level, the types of grades they receive, and this is where collateral contacts are important. Your client may say they make all A's and really they're failing everything. And those are different things, and we need to have an accurate accounting here. You want to talk about if they've had any current or past employment. We want to talk about their hobbies and their leisure activities. So, writing down what they enjoy doing. They enjoy doing hair and makeup, or they enjoy learning about cars, or they enjoy taking things apart. They enjoy playing sports. We want to talk, what do they do in their free time here? Legal history. The better way to ask this versus do you have any legal history would be, can you tell me why you've ever been in court? If they're in CPS care, at the very least, there's going to be some custody. There's going to be some, maybe there was some termination of rights. Maybe they've talked to a CASA worker. They may have been arrested before. So ask them that. Have you ever been arrested? Whether it's for parking tickets or an anger outburst or whatever it is, we want to detail any involvements they've had with the police or with the court system, including arrest, summons, and their sentence. We want to talk about the occurrence, how long this problem's gone on, if there have been several arrests, what different steps have been taken in the past. The SNAP section is very important. It should be at least 4 sentences so that each letter is addressed. Their strengths may be from your observation, the client's report of accomplishments, client's report what they're good at, or even from the staff reporting. Their needs are going to be things that they need to learn to improve their behavior. Let's try to keep the needs focused on behaviors so that we know what to do in a treatment plan. Not to say that they don't need clothes or they don't need adoptive parents or they don't need, things of that nature, but as best we can, let's try to get to needs that we're going to be able to address with our services. They may not be able to give a good answer. As a clinician, you can also fill in the gaps based on their symptoms and behaviors. They may say that they don't need anything, but you may be able to tell, well, you need anger management because you keep getting mad and punching holes in the wall. That's a clear need. Or if you're dealing with an adult, it may be that they need stable housing or they need more positive social interaction. They need an outlet. They need coping skills. And you want to be as specific as you can because it will later help with the treatment planning. Next is their abilities. This should reflect improvements that they've made in the past or what it took for them to make their accomplishments. You might also ask them, what can you do that someone else in your situation can't do? You might ask, what can they do now that they couldn't do 2 years ago? And it may just be that you make your own assessment of what their abilities are. Maybe they were a clear and honest communicator. Maybe they have improved on their anger management. Maybe they have demonstrated the ability to be stable in a placement if they've not been moved around a whole bunch. Their preferences should be based on what sort of interventions they prefer, like role playing, talking, written materials. How do they want to receive services? Also, when and where they want to be seen, at home versus school. When you go out to the house, they want to be one of the first kids as opposed to one of the last kids. If they need to be seen more than once a week, if they only want to be seen once a month. We're not going to be able to adhere to all of these preferences, but we definitely do want to hear from the client what sorts of things they want. Maybe they like to do art. Maybe they need to be very hands-on. If we've got an ADHD diagnosis, then they're not going to do as well with written materials and solely talking as someone who's socially withdrawn might do. Other important information that's relevant to treatment. This is any other information that maybe the caseworker or the client have told you. Definitely ask this question. I phrase it, is there anything else you think I should know that I haven't asked you about? You might put down other workers that they have. You might include barriers to services or any other relevant information. Then we have our plan. We want to talk about the next steps in the treatment process, including if we need to do any diagnostic testing, if we're going to develop a treatment plan, if we have a next visit that's already scheduled, whatever we're going to do after this initial assessment. For diagnosis, we want to, this requires the F-code diagnosis. As best we can, we want to get this from paperwork provided by either the house, by your supervisor. If they're old enough to know their diagnosis, okay. But for the most part, we want to make sure that what we're getting here is very clear. They may say, I have depression, but there are several different F codes that cover depression. So we want to make sure that we have the most accurate diagnosis possible. Then at the bottom, it says, sign this form once you have finished. If you are doing this concurrently while you're in front of the client, you may just click Save Draft and wait until you can go back and click on that ABC button in each box to make sure that you're Spelling is taken care of. You want to make sure that you've written in complete sentences for every single box. We don't want to just list answers. Client is 16, white, male. We want to have a period. We want and. We want full sentences. Grammar matters. You may not be the only person who reads this, and we want to make sure that if we need to submit this to insurance, or God forbid the file gets called into court to support something as supporting documentation, we want to make sure that this is a professional, comprehensive document. We don't want to write this as if we are buying the vowels and paying for each letter. The more information, the better. The last thing we want is 7 words for each of these boxes, and then we expect somebody else to really know this child from it. The more information, the more details you put, the more useful the document will be. Thank you.